Well, good afternoon and welcome to another episode, I guess, of Dialogue with the Dean. Maybe it's Dialogue with the Deans this time. We took a few months off here in the College of Pharmacy during the pandemic, but we're now back virtually bringing you more campus updates. Before we start, I just want to remind everyone that might be watching the video, if you have any questions or comments about the content of the video that you're about to watch, please feel free to leave those comments on the comment section in Facebook, and we'll be sure to respond to your questions. Today we have with us Dean Marion Underwood from the Purdue College of Health and Human Sciences. It's an exciting time for both of our colleges, I think. And if you haven't heard, the College of Pharmacy and School of Nursing, that is in the College of Health and Human Sciences, have come together in a very collaborative effort to build a new building, and we call it the Active Clinical Learning Facility. And Dean Underwood and I are very excited about this new opportunity, and hopefully we'll be able to share a little bit more about that today. Dean Underwood, welcome, and thank you for joining us today.
Thank you very much, Dean Barker. Thank you for having me.
Yep. So tell me a little bit about, from your perspective, what collaborative opportunities, educationally or professionally, will this new facility lend to pharmacy and nursing students?
Well, to me, collaboration is all about relationships. You collaborate with people you know and you feel comfortable with. And I think by putting nursing faculty and pharmacy faculty together in this amazing new facility, that there'll be all kinds of formal and informal opportunities for people to get to know each other, to appreciate each other's research, and to appreciate what the other discipline might have to offer. So, you know, in terms of prior collaborations in the research area, pharmacy and nursing faculty have worked together on research to examine the outcomes of experiential learning techniques. Pharmacy and nursing faculty have collaborated on research on preventing opioid addiction, and have also collaborated on NIH-funded studies of smoking cessation. So, you know, really, a School of Nursing and a College of Pharmacy are all about health. And so how can these groups not find common interests? And I think there haven't been barriers before, but just putting people together in physical space where they'll bump into each other, where they might go to the same cafe, where they have an easy place to just sit down and talk for a few minutes, can make all kinds of things happen. Really be exciting.
So as we have now gotten to a point with a completion of a feasibility study, and for those who don't know, we have a pretty firm idea about what this building would look like, what the size would be. We're very grateful that the Board of Trustees has moved this forward to the state, or will be moving it forward to the state as the #1 academic priority for the next state of Indiana biennial budget. Obviously, we don't know much about what state budgets will look like in the next year or two, but we will remain optimistic. But we've put together a pretty good plan. So from your perspective, what new technology or innovations will this new facility have that maybe are not currently available to our students?
Well, to me, what this facility will bring that'll be the biggest kind of new piece are these amazing facilities for simulation and active learning for both pharmacy and nursing students, where they can work together. So the School of Nursing has a simulation center now, but it's so small that it can barely accommodate a few nursing students at the time. What we envision here are our active learning facilities, active learning classrooms, much better physical spaces where we can put nursing and pharmacy students together, where they can learn from each other, where they can appreciate what the other discipline brings to the kinds of teams that they will be joining in their careers. And so there's, there will be an amazing simulation center in this building that'll be incredibly helpful for nursing and for pharmacy students, where they can gain experience interviewing patients, working with patients, talking with patients, but also for nursing students, developing the psychomotor skills necessary, because it's not just about giving injections. Nursing students are learning to place catheters and do all kinds of kind of invasive procedures where they have to do it exactly right to minimize distress or harm to the patient, discomfort, but also to minimize infection. And so working with high fidelity mannequins, essentially robots, is an incredible way for brand new nursing students to get those psychomotor skills. And I think those same mannequins, those same robots could be helpful for pharmacy students for the skills that your students need to do. And in addition, we'll have rooms for where students can practice with simulated patients, with people who are actors who come in and behave as patients. And those rooms can be set up to be to look like a home or to look like a psychiatric hospital room, because so much of healthcare will be moving out of the hospital, really starting now with a kind of emphasis on telehealth and the pandemic, but healthcare will continue to move out into the community. And so these spaces will give students a chance to really practice in spaces that will look like the spaces where they'll be learning. So a lot of things in this building will be kind of virtual and augmented reality. There'll be a lot of technology for wearing a set of goggles to help you feel like you're doing a procedure, working with the high definition simulation with debriefing. And I think to have this technology available in a space that's big enough for both sets of students to use it separately, but also use it together, to really interact with each other, to appreciate what each discipline brings. I think that will be new and exciting and something that really is not available at almost any other place besides Purdue.
Well, that's a perfect lead into my next question, which was how this new facility will help set Purdue's nursing program, the School of Nursing here at Purdue, apart from other programs either in the state or around the country.
This new building will give nursing and pharmacy students the chance to work together to really understand each other's disciplines in a kind of a collaborative, interprofessional educational model. We also have to remember this is Purdue. And so the emphasis, I think, of both of our programs is a little bit on technology. We have a wonderful College of Engineering, and we have an environment steeped in engineering. And so there's amazing possibilities for collaborations with engineering, for developing new technologies, new systems. I think in the College of Pharmacy and in the School of Nursing, we pride ourselves on training leaders. We're not training people to just go out and do the minimum. We're training people to really be leaders in their professions. And what an incredible opportunity to get to do that side by side with professions that they'll work with throughout their whole careers. And with engineering right here, we have some amazing opportunities to work on new technological solutions, to do really collaborative projects. So I know our nursing students recently worked with a team from engineering to come up with, this industrial engineering, to come up with a new way to set up storage of medical supplies to avoid accidental overdoses of medications in young children. They really thought together about how can we set up where this stuff is so that the medical professional in the room is most likely to grab the right thing. In a way, that's an engineering problem. And we're lucky to have engineering right here. So I think this new building will help our disciplines, pharmacy and nursing, work together. It will also help us work with engineering to enable us to come up with some pretty amazing new technologies.
It is very exciting when we look at all of the possibilities that we will have together. So as is always our case, after I ask a few questions, we give our guests a chance to ask a question or two. Maybe you've got a question for me.
Sure. So Dean Barker, what about pharmacy? I mean, how will this new building really advance the College of Pharmacy? You all have a top 10 program. So how will this building set it apart even more?
One of the challenges I think both our programs have is because we are here in West Lafayette, we don't have an academic medical center here on our campus per se. Many of the clinical resources that would normally be available to our professional students, both pharmacy, nursing, and other health professions, many of whom are also in the College of Health and Human Sciences, we don't have those opportunities here on the campus without that med center. So we need these more advanced clinical spaces. Purdue and the College of Pharmacy have really been leaders in this area of clinical pharmacy for decades, even before it was a term. I think it's interesting. I found the original plan guide for the existing pharmacy building, the Heine Pharmacy building, and in it, it describes the need for at least one clinical pharmacy office. This was 1964 or 65 when they were talking about this. I'm not even sure clinical pharmacy was much of a discipline in 1965, but Purdue Pharmacy was thinking about it, making sure that there was going to be at least an element of it in this new building over 50 years ago. So I see two main opportunities. First, you've already talked a little bit about it, but it's very, very important to reiterate more interprofessional interactions between our students, nursing students, and the other health profession students that are in your college. I hope that we can find more opportunities to bring all of these health profession students together. It's key to excellence in patient care. It's going to be essential, as you said, as they're going to have to be on the healthcare team together. And we want them to be part of exemplary healthcare teams, practicing their disciplines together at the highest level of excellence. So I think interdisciplinary and interprofessional interactions is one thing. And the second thing, as we continue in pharmacy to see a significant shift in our profession from a focus on product, that is providers of product, in our case, medications, to being providers of direct care. And so if we are to fulfill our mission as a college to train the next generation of leaders in pharmacy and the pharmaceutical sciences, they have to be ready to provide direct patient care. And this new space, because of the way you described it, gives us opportunities to engage in active, hands-on learning in a way that our current facilities, both of us, just don't allow us to do at the highest level of excellence. And these are programs of excellence, and they need space that reflects that opportunity for our students. And so this is going to be a whole new level of instruction, I think, in clinical training for both programs. It's very exciting, and I look forward to the day when we open the building, but I look even more forward to the day when we start to see our graduates coming out of these experiences that they've had in this new facility, and we begin to hear the stories of how this facility has transformed their ability to learn their disciplines individually and together, and as they go out into their practices to do that. There's been already some great examples where Purdue Pharmacy and Purdue Nursing are working together this semester, we've been in the pandemic, working together to help with COVID-19 testing on this campus earlier in the summer. Pharmacy and nursing side by side working. We were actually initiated the first on-campus testing at a high level, and it was a joint effort between the two programs. And most recently, last week, was the mass flu vaccination clinics going on campus. We have the goal of flu shot for all, and seeing pharmacy students and nursing students working together to help protect Purdue, advance this. These are just two small examples, highly impactful examples, though, of how our programs are already working together, and we look forward to seeing how this is going to how the new facility is just going to advance this going forward. And so I think as a top 10 program, being able to, again, to enhance interprofessional education, to enhance our students' ability to train, to provide direct patient care, the active clinical learning facility is just going to catalyze this in ways that I'm not sure we fully appreciate even yet, and we look forward to hearing the stories down the road.
Yes, absolutely. I agree.
Yep. Well, thank you for joining me today briefly. Those that are watching, please comment if you would like on the video. If there are questions about the things we've talked about, please post those. We'll get back to you. If there are any topics that you'd like to see us discuss in the future, be sure to ask those as well, and we'll put those on the agenda. Dean Underwood, thank you. As always, it's a pleasure to spend time with you. Thank you for your collaborative spirit. You're a valuable colleague on our campus. You're a tremendous leader for our campus. Purdue's very fortunate to have you as the leader of Health and Human Sciences, and I'm grateful to have you as a colleague, and grateful that you spent time with us today.
Thank you, Dean Barker. I feel the same way about you. Thank you very much.
Again, thank you all for watching. We'll see you next month. And as always, hail Purdue and boiler up.
Hail Purdue.